Hi, Dr. Carol.
Hello.
Hi, how are you?
I'm good. How are you?
Good. Let me make you a co-host.
Thank you.
Okay. And you should be able to now share the screen if you'd like and things of that nature. Um,
Perfect.
the webinar is recording now, so of course, when we put it up afterwards, we will cut all this parts out. Um,
No problem.
and it's just Dr. Davis is joining you, right?
No, so right. So she like is a major overseer of the work, but I have my colleagues will be presenting with me who actually performed the work. And so that's Michelle McCullough and Rochelle Paul Brutus.
You mind Rochelle just joined.
Excellent.
I don't see her. Mhm. Oh, she joined as a attendee. Okay.
Oh, okay.
Let me okay. Let me see if I can get her.
I'm just gonna grab some chapstick, but
Yeah,
I
no
can hear
problem.
you.
Go to panelist.
Hi.
Hey, Rochelle.
Rochelle?
Yes, this is
Hi.
Rochelle. Yeah, because I click on the link that you sent and I'm like, oh my God, can she hear me?
Okay, it must have just connected you as a participant. So it's Dr. Carol, Rochelle. Is Michelle also? Okay,
Yes.
Michelle. And then Priscilla is not.
No.
No. Okay, okay, great.
Yeah, sorry. I know it was
No, it's all
a little
good.
confusing. And I appreciate you helping us out today.
Oh, no problem. Appreciate you guys participating in this. Hi, Michelle.
Hi, good morning, everyone.
How are you?
Good.
Let me just turn off all of my sounds.
And I would also like to, I'm not sure that we have 55 minutes worth of material because we thought it was supposed to be shorter, but Rochelle and Michelle, feel free to expand on your your slides because we have plenty of time. So
Yeah. Let me just.
do we also have access to share material in the chat? Is that
Yes.
okay?
Yeah,
Okay.
you can definitely feel free.
So Rochelle or Michelle, if one of you in the slides, I have the 3 links on at the end of the resources with the link to the mental health resources page, and then also links to our poster presentation. If one of you could potentially pull those and just all you have to do is just post the link as is, or I can wait until we finish and I stop sharing and I can post them. But if you're able to do it when I'm presenting, that would be helpful.
I'll have to say that I'm not as savvy about that.
No problem. That's totally
About
fine.
posting in the chat. So
No problem.
If you
I'll
want to
have to
send, if you want to
recuse
send
myself.
links my way too, I'm happy to share in the
Oh,
chat.
that would be great.
Yeah.
So they're in my slides. It is slide number, towards the end, slide
Okay.
number 29. That's the
Okay.
second to last slide. And there's 3 bullet points. You could literally just copy and paste each bullet point, like maybe one at a time, but
Okay.
that would be amazing. Thank
Gotcha.
you.
Um,
And I'm so sorry again for my email snafu. I mean, the slides didn't change too much. I just tried to add some color, but yeah.
Not a problem. Hopefully all of the sounds on my computer are on.
Same
Okay.
here.
So, so y'all are aware of the format. So, you'll present and then feel free to go into conversation. I can help with also filtering questions from the audience, and I can, if you guys don't mind, I can either say, interject a little bit in a friendly way and say, hey, we have a question, or I can just put it in the chat as well. And I can do both. So feel free.
Yeah,
Okay,
that sounds great.
cool.
Whatever is easiest, and probably the more methods, the better. Just to
Okay,
make sure.
Cool. And
And what type of audience have you seen in the past webinars?
it's
What
been
type of, what's the mix been?
in terms of like demo.
Well, just, are they, more community people, more institutional research people, more journalists?
Right. It's been a mix of community and research, as well as some funders from different foundations. So I would say it's more of those three stakeholders that have shown up.
Mhm.
Very cool.
And Michelle, is your last name pronounced McCullough?
Yes,
Okay.
perfect.
Okay. And Rochelle, it's Rochelle Paul Brutus.
Yes, Michelle Paul Brutus.
And Dr. Carroll, would you like me to call you Dr. Carroll or?
No.
Okay.
And actually, I was going to say if I could remove that from my
Okay.
my name, I definitely do not need that.
Okay, so you prefer me to call you Allison Carroll?
Yeah,
Okay.
that's great. Thank you.
No problem. My instruction will
So
be very brief. So, I'm sorry, it will be very brief. So I will strongly encourage, if you would like to share more about yourselves, please do so.
that's exactly what I was just gonna
Okay.
kind of make sure it talk through our plan a little bit. So yes, I'll start and introduce myself and a very brief overview, and then invite my co-presenters to introduce themselves. Michelle, would you like to go first, and then Rochelle? Is that okay?
That's fine.
Great.
Great. And
Mhm.
you can each do an introduction for yourselves, and then I will jump in.
Great. Okay. A few more minutes and then we'll get started. And if you need me, I will be here. Just feel free to message me directly. But after I introduce you all, I will go off camera. And I'll be hidden from the panel, so you won't be able to see me there.
Sure. Thank you.
So in terms of the question, you're gonna flag us when there's a question in the chat in case we don't see it and just say it?
Yeah, in case you don't see it, but by all means, if you happen to see it before me, feel free to take it on amongst the three of you.
Sorry, one other question. So does it make sense for the Q&A to stop sharing and to have it just more open discussion based at that point usually? Is that what folks have done?
Yeah, it's you stop sharing and then yeah, it can be,
Great.
you know, full on conversation. But also, you know, feel free if you want to show any other, you know, revisit any part of your presentation, you can do that as well.
Okay, great. That'll make it easier to see the Q&A if I'm not also sharing.
Okay, cool. All right, let me get started. Welcome everyone. More folks will be joining us as we continue, but we're going to get right away to starting this important conversation. My name is Olivia Obinaman. I am the Director of Journalism and Media Engagement at Public Narrative, a community and media resource nonprofit here in Chicago. And we're so excited to be in continuation of our Power in the Public Narrative webinar series, which is a part of our public health series in partnership with Congo Square Theater Celebration of Healing Initiative. So we're so excited to be part of this conversation, as well as part of the bigger, large discussion of public health in our city. I'm joined today by 3 guests that have been part of the Healthy Equity Zones projects. And as you may know, if you've been part of our web series, we have been sharing out these different presentations, different projects that have been happening across the city. So you'll get to hear more about their project in their presentation, and also interact with them in conversation following their presentation. We have today Allison Carroll, we have Rochelle Paul Brutus, and last but not least, we have Michelle McCullough, all part of a team for a project that centered around community emotional stability through a faith-based community and academic partnership. So I will let Miss Allison and the rest of her team to present.
Thank you so much, Olivia, for the very kind and warm introduction. And we are so honored and flattered to be here as part of this initiative and part of this celebration of healing. We really feel strongly about that as a concept with all of the work that we're doing. So it's really great to be able to share as part of this webinar series. I am Allison Carroll, and I am trained as a clinical health psychologist, and I'm currently working as a research assistant professor at Northwestern University. A lot of my work is focused on figuring out how we can best support the mental and physical health of individuals, especially those who are already in situations, communities, populations where there are fewer resources. How can we bring resources that are going to be helpful for the community to meet people where they are at? And I am presenting today with 2 of my wonderful colleagues who I will pass the mic over to introduce themselves, starting with Michelle, please.
Hello, everyone. I'm Michelle McCullough, and I am on this team with Allison and Rochelle. I'm also a member of University of Illinois' Community Engagement Advisory Board, as well as the C3, which is the Chicago Consortium for Community Engagement, which encompasses several of the institutions in the Chicagoland area and community members. And I'm also a longtime resident of the Southside of Chicago. And I'll pass it on to Rochelle.
Good afternoon, everyone. Rochelle Paul Brothers. I am super excited to be here and to co-present with Allison and Michelle. I've been a member of the Community Advisory Board for, I think, about 2 years now. And this journey has been wonderful. And I'm very excited of this platform for us to share a little bit about this study. About me, I'm also a Southsider. I'm also passionate about community work, community voice, community groups, community organization, everything community. I work currently for a non-for-profit called Partners in Health, when we are trying to fund organization to enhance the work that they're already doing. And we're working in close collaboration with them to aim for their success. So again, thank you for having us over here, and excited to be here.
And today we're going to be sharing some of the work that we've been doing through our faith-based community academic partnership focused on emotional stability in the community, especially on the South Side of Chicago. And before we dive into that work, we have so many people to thank, so many people who can't all be here to present. Otherwise, we'd each get one word in during this hour. Of course, first and foremost, we have to thank all of the members of our Community Advisory Board, or our CAB. They have been wonderful. They have really stuck with us. Everyone is super invested in this project. I could not ask for better engagement and excitement from folks. Dr. Diana Ingram is very sad she could not be with us today, but she has been my partner in crime on this project from the beginning, in really leading and organizing and advocating for this work and the importance of the work that we're doing. So many of the words that we will share today come directly from her and her enthusiasm. Dr. Paris Davis as well has been just completely key for making this partnership happen. The work that she and her team do at Total Resource Community Development Organization, TRCDO, which we will also introduce a little further on. Just the work that she does in and for the community and the connections with research are instrumental for this and many other projects. Dr. Rebecca Johnson has been our whiz in evaluation of community-based work. She has many, many years of experience in qualitative work and community engagement and doing things in a way that makes sure we are not causing harm to the community, and we are grateful for her guidance. Bishop Simon Gordon as well has been supportive from the beginning, really in the focus on mental health and the importance of emotional stability in the community, and in encouraging folks to work with us. Dr. J.D. Smith, currently at University of Utah, is a academic advisor and has partnered a lot with Dr. Paris Davis, and their partnership has been influential in our partnership. Alderlyn Munson has been great for helping us with some of the logistics nitty-gritty of making sure we are able to provide an honorarium, for example, for our CAB members. And so we could not function without her. And then, of course, we would like to acknowledge our funder for this work, which was through the Alliance for Research in Chicagoland Communities, or ARC, at Northwestern University, who provided this Health Equity Partner Development Seed Grant. And we are forever grateful to them and the resources that they provide to both academics and community members. So wanted to share that right up front, because this work could not be done without all of these folks. So a quick overview of where we're going today, what we're going to be sharing with you all. We are going to start by just talking about what is emotional stability and why this is important in the community, and a little bit of background on community academic partnerships. We will then talk specifically about the goals of our Community Advisory Board that came out of our community academic partnership. We will share a little bit about the members of our board, the activities we've engaged in, and what came out of the work that we've started so far. And then we'll talk about where we're at now, because we are still very actively engaged in this work. And we have a lot of exciting things coming down the pipeline. So to kick us off, I will turn it over to Rochelle.
Thank you, Alison. We wanted, before we jump into the detail of the study, to kind of level set the conversation by just talking briefly about the state of health of Black residents in Chicago. And being in this platform and the other topic that you all have engaged in the past, we all could agree that the state of health of Black residents demand urgent attention. The overall life expectancy gap between Blacks and non-Blacks is widening. In 2020, the gap was 9.2 years of the life expectancy gap, with this driver being chronic disease, homicide, infant mortality, infectious disease, and opioid overdose. But I'm sure after going through a pandemic, this gap has increased. And I don't have the exact number, but it's more than 10 years now, the gap between the two groups. And we all could agree that these gap is a result of historical and present form of systemic exclusion, source of toxic stress, which prevent this group of achieving health equity. And as it's not surprise again to all of us, it's like many of the health outcomes in the Black community are worse compared to other race groups. And mental health, like many of those health issues that you all have heard about in this platform, is not excluded from this issue. Oh, next slide, please. Thank you. So now I just want to also give you a brief overview of mental health in Chicago. And the data that I'm going to share with you are all come from the Chicago Health Atlas, which is a database that is publicly available to everyone. So Blacks are more likely to experience serious psychological distress in their everyday life. So for those of you not familiar with the term psychological distress, it is based on how often an adult feel nervous, hopeless, restless, depressed, and worthless. And in 2018, 7.2% of all Black were experiencing serious psychological distress compared to 5.4% of non-Black. And this number is higher among women versus men. Other type of data that I wanted to share is the mental health hospitalization rates among Blacks. So in 2017, for mood and depressive disorder, 87.9 per 10,000% of Blacks reported being hospitalized for mood and depressive disorders. And for schizophrenic disorder, this number is 89.2 per 10,000. Of course, those are numbers taken in 2017, but we could imagine with a pandemic, again, these numbers must have increased. Unfortunately, the data does not exclude our young people who are also suffering from mental health. And the depression rate among high schoolers have went from 31% in 2017 to 41% in 2021. So by me being a community member, a mother, looking at those data, I really feel like I mentioned before, this is something that demands urgent attention. And that's why I was so excited to be part of this CAB, because, the focus of the CAB really has been around psychological well-being. And for us, psychological well-being, we have defining it as the way an individual is a critical aspect for an individual physical health, as well as community health and resiliency. So now I'm going to pass it on to Alison to continue with this journey around psychological well-being.
Thank you, Rochelle. Yes, really important to emphasize why we're even doing this work. And I just want to piggyback on that mental health is health. And this is why it's really important for us to think about how we are going to prevent and then intervene on any mental health issues. We know that when we treat mental health conditions such as schizophrenia, such as depression, such as anxiety, that this can improve one's health behaviors, the things that we do to keep ourselves healthy, like regular diet and exercise. And we know that that's associated with better physical health outcomes as well. And so when we take all of this together, we can hypothesize, we can make the leap, I think, here that preventing and treating depression and other mental health conditions among the African American residents in Chicago, especially those who have other comorbid medical conditions, can improve not only their mental health, not only those symptoms of depression or anxiety, but also in this case, specifically blood pressure control. While we're focusing on something pretty specific, looking at depression and hypertension, we do think this expands much more broadly. And especially at this level, in this stage that we are currently in, we are looking at this as a very broad base of promoting emotional stability in the community. The other important component of this is that any interventions that we do, interventions being anything that's a direct influence on one's behaviors, whether that's psychological or physical or cognitive or behavioral, that they should be adapted by and for the community and the people of the community. This should not be done by researchers in the ivory tower and then brought to the community. This should not be expecting community members to come to the academic or medical institutions. That we've seen when interventions are appropriately culturally adapted, they tend to be more effective for those folks that they've been adapted for. And these are usually folks who have been historically excluded by research, such as Blacks and African American people. A way that we think is really important to do that type of work is by developing these community academic partnerships, which we've already talked about several times at this point. We find that partnering with community members and organizations is that critical ingredient for making sure that our interventions are effective, that they are sustained over the long term, that they are going to be implemented in a way that it makes them useful for folks. And we know that too often these partnerships occur after the research project has already been initiated. And so that's just really going to limit the impact, the positive impact that it could hopefully have. So our goal here, the aim of our initial work, was to prioritize the community voice from the beginning by bringing together a community advisory board, or what we'll refer to as the CAB, throughout a partnership development grant is how we were funded, as I mentioned. And just to get us all on the same page, the way that we are thinking about a CAB is that it consists of representatives of the general public or people from the community who then meet with representatives or people from an institution to relay information between these two groups. And CABs are traditionally associated with the idea of clinical research, although it can be a much more broad different types of focus. And historically, the purpose has been for the community advisory board to review the ethics of the research and any concerns that might arise to make sure that we are conducting ethically sound and non-harmful research. And so you can see why doing this from the very beginning is really important for making sure we're anticipating anything that might come out of that, rather than having to course correct and fix things later. Our community academic partnership, I would argue, is really made up of three components, although technically the only named ones are Pastors for P-Corps and Northwestern Medicine. Of course, there's the CAB members themselves that provide the community representation. So starting with Pastors for P-Corps as our faith-based organization, Pastors for P-Corps actually came out of a research grant that was given to Total Resource Community Development Organization, or TRCDO, where I mentioned Dr. Davis is the executive director. And TRCDO is a nonprofit entity that offers many, many different amazing services for the community. And they really want to help the community members to live healthier and more productive lives. So the types of resources that they provide include housing counseling, utility assistance, community health research, which is where we come in, health awareness activities, youth programming, and a food pantry. So just amazing work that they're doing. And then within that, the Pastors P Core group conducts trainings for community members, and they conduct training for research. They've developed a strong network of research ministry facilitators to go out and train other community members and to conduct community-informed and community-engaged research. And Northwestern Medicine, as you likely know, it's a academic community health, or not community, academic health center, partnered with Northwestern University as an institution, and has many, many millions, if not billions, of research dollars every year to conduct really innovative research. And they have also done a lot of community-based research. And then the community representation, of course, as I mentioned, by all the members of the CAB is a really critical piece. So the goals from the beginning that we set out for our CAB, our overarching guiding principle is to oversee the provision and evaluation of resources and services promoting emotional stability, which we'll explain that term, but emotional stability, psychological well-being, mental health in Chicago's Southside community. The short-term goal of this phase of the research that we will be talking about is to adapt and implement and evaluate one specific evidence-based intervention for depression or emotional stability among African-American adults on the South Side of Chicago. And the long-term goal is really to develop and implement and sustain community-informed resources broadly. Hopefully this intervention, but also thinking about other ways, because no single intervention is going to be useful for everybody, right? Everybody's going to have their own preferences and their own ways that they would prefer to be engaged. And so our long-term goal is to really build up the whole availability of resources so that there's something for everyone. We, again, are describing this as our phase one work, which is really foundational. It's not even really a research study at this phase. It's really setting up that partnership so that we can have success when we dive into the research down the road. So the purpose of this work and what we're sharing with you today is to describe the initial development and activities of the CAB and to evaluate the collaborative work of the CAB. So our CAB members, as I mentioned, are awesome. We took some very basic demographics at the start. So majority women, majority African-American, on average about 55 years old, and a variety of Christian religious identities. Half of folks were born and raised in Chicago, proud Chicagoans, been here for a long time, a lot of investment in the city. And 100% of members of the CAB have been in Chicago for at least 10 years. So there's a lot of history and experiences that folks are bringing. 75% of our group had some prior research experience. And within that, everybody had like a little bit of everything. So, a couple folks had some experience with an IRB, a couple had some experience with data collection. So a lot of different experiences. And nobody, had started a research study from start to finish in doing all of the pieces. So there's also a lot of back and forth learning that we have about the different aspects of research as we're going through. And everyone in their own way is coming with interest in learning about mental health and cardiovascular disease. As we mentioned, the cardiovascular disease is kind of an extra focus of our project, but we can also think about this as physical health more broadly. And everyone is really passionate about engaging and supporting the community in doing this. Another piece of our CAB membership that we'd like to highlight is that there really is a broad range of experiences, and that is so crucial for the amazing information that we are learning, and that is going to be useful as we think about putting this information out, because everybody's coming with a nice variety of perspectives. So we have folks who are very strongly have a history of research and that background. There's some perspectives from the government side of understanding policies and how the city of Chicago is functioning and supporting resources and providing resources or not. Folks from other academic institutions outside of Northwestern, as well as background in education and background specifically in faith-based organizations. So we conducted 4 CAB meetings over 1 year, and that was, again, this foundational work that we're talking about today. The format of each of these meetings was to start with some introductions and some sort of emotional stability related icebreaker activity. So we all got to share favorite advice that we had given or received over the years. We talked about winter activities to do in Chicago, such as knitting or crafting. We then would give a very brief presentation about a given topic and spend most of the meeting time on discussion of 1 or 2 prompts that we will share with you in the next couple of slides, and then a brief wrap up and talking about next steps. All of the meetings were video and audio recorded so that they could be available to CAB members later if they weren't able to attend a given meeting. We wanted to be as flexible as possible. And then CAB members who missed a meeting were invited to watch the recording and review the materials and still be able to provide their input so that all voices were heard at all stages. And we also provided an honorarium for the CAB members. So the first session, the goal was really just to learn about each other. So from the academic side, I shared the aims of the grant proposal and what our original very preliminary goals were for the CAB, while also, I hope, inviting that and leaving that open for flexibility to design our own path. The community members also shared their interest in why they wanted to join this CAB, what sparked their enthusiasm from the invitation that we sent out to members. Then we were really setting ground rules, understanding the philosophy and principles, the shared responsibilities, consenting to the sharing and making this a safe space, as well as completing the memorandum of understanding. And I will turn this over. Thank you.
For the second meeting, what we wanted to spend the time on is really to answer the question, why is psychological well-being important for the community? As I mentioned before, psychological well-being for us is a critical aspect of an individual physical health as well as a community health and its resiliency. But we wanted to really spend the time to answer that question, why it is important. And as you could notice that we were very intentional not to use the word mental health. So we really took the time to really make the difference between the word mental health, who had like sometimes a stigma connotation for some individual, and we use preferably psychological well-being. And for us, psychological well-being really, like I think Alison mentioned it before, it's something around emotional stability. Is how one would preserve themselves in the midst of what we are experiencing. It's really finding balance. During that session, I recall that we did like a brief reflection on the type of outlet we used to have growing up. And we saw that nowadays, like there's this loss of balance. The moral compass is missing. And this is a result of a lot of violence that we see in the street. So really, answering that question, why is psychological well-being important for the community? Our answer is really because it will allow the space again for real community, a community where we can build more partnership, be more respectful of one another, and really, again, a community when this balance can be restored and people can be, instead of reminiscences of what was, really actually living this balance that we once lost.
So when we move on to CAB meeting number 3, and I just wanted to quickly add on to what Rochelle was saying about the term emotional stability, is that we really wanted to make sure that we had a term that people could embrace and something that people can strive towards, and to kind of remove the stigma that maybe that mental health holds for many people and many people within the community. So during our third CAB meeting, this was the time when we really looked at what currently exists in the community. So we had 2 key questions. The first question was, we wanted to look at what resources to promote emotional stability are currently available in the community. So as a group, we brought different resources that we were aware of. Some of them included some of the community health centers that may have had behavioral health programs that are part of their clinics, their locations. We also talked about faith-based communities that may have health ministries that might involve an outlet for people that may be experiencing stress or distress. We also looked at there may be some community organizations that were playing a part in providing those services, and those were some of the go-tos. Also, organizations, when you look at some of the professional organizations that might be available, like the Black social workers or other ministries that may be available in the community, and also some of the apps that might be available that people know of that we can reach into, like Calm and 10% Happier. Those are just some examples. But with that, we all recognize that there were gaps in the community when you're looking towards resources for emotional stability. You know, what can you reach out to? What can you connect to? So the second question that we discussed was what else was needed to support emotional stability in the community? And like I said, where are those gaps? Some of the things that came from our discussion is that we looked at, what education was available for the community to be able to know what is available, to know when they need to reach out, and to know that there's a source that they can go to for help. How is that information getting out to the community? How are people aware of what's going on? If you're aware of a resource that you can go to, how do you link individuals to those sources? We also looked at what could be leveraged, looking at the schools, programs in the schools that could assist with providing that link to health services for emotional stability. Faith-based organizations, how could that be leveraged? Some of the churches do have those services in place through their health ministries, but others, that might be a broad network that could be tapped into. And also some of the health centers. There was one health center, Chicago Family Health, that actually had behavioral health programs, and they have locations throughout the Southside of Chicago. But how do you get some of the other health clinics and health centers involved in that? And we also talked about mental health, mobile mental health units, how to be able to respond quickly for conflict resolution, for self-care, locations, is it easily accessible to people? And one other thing that was brought up is that you have other health issues that actually have health promotions, navigators, advocacy. Like you see some of the programs for breast cancer awareness, lung cancer awareness, but do you really see that for mental health as people strive to achieve that emotional stability? And, policy investment and funding for that. So we had a pretty broad discussion on that. And as a result of that, the CAB began building a resource list of all that we knew was available and what people could tap into. And it's almost like the phenomenon, if you, you never see any blue cars, but this, as soon as you see one, then all of a sudden you're alert to blue cars driving down the street. And that kind of organically happened with the group where You know, we would see something on the news. We would see there was something where different music artists, Megan Thee Stallion, there was something regarding mental health. There were other organizations and groups who may have been trying to put out an app or trying to connect. So I think that that ties into what we were talking about, awareness of the community, building that awareness. Once you have that awareness, then it seems like the resources come to meet the need. So next slide.
Thanks so much, Michelle. That was such a great overview. And also, every time you start to list it out, it just reminds me of how much there is, how many different ways we can hopefully get to folks. And yet so often the reach is just not there. So what type of work can we do to make sure that more folks are getting those resources, because there's a lot of amazing stuff out there. And so that was actually part of forgot that was actually part of our discussion then, is really figuring out, okay, we have this great list. What can we do with it? What's the best way to utilize it? It's great that our individual CAB members are sharing it with friends and family or as it comes up. And also, that's why we wanted to use this platform today, to be able to share this list out with you and your networks. One thing that I'd like to point out is that we also included a brief interest form on that list, so that if you want to be able to follow along, one of our next goals is to set up a listserv or some sort of way of getting this information out on a more regular basis and being in touch with you. So if you are interested, when we get that developed, we would love to be able to stay connected. That came out of our brainstorming in this last meeting. We also just had a discussion amongst ourselves about what we've all taken away from the time that we spent together having these discussions, and reviewing the progress that we've made and talking through what our next steps would be based on this foundational work that we conducted over this year. It was really just, I'd just like to say that these common understandings that we developed are just building and developing, blossoming more discussions, plans for implementing these resources, and also starting to disseminate the work that we've done, which we will be sharing with you as well shortly. And then another piece that we wanted to do was to do an evaluation of the work that we've done. We think it's really important to make sure that we are all on the same page, or if we're not, figure out how and where and why, so that we can work through this as a process, rather than getting to the end of something and figure out that, oh, something broke really early on or wasn't working from the beginning, and then needing to fix it. So along with Dr. Rebecca Johnson, who I mentioned is a whiz at these evaluations and especially of community work, surveyed our CAB members and identified our areas of successes and our relative areas for improvement. And the areas that really came out on top is that our CAB members really believed in and understood the purpose of the CAB. And so an example of this survey item would be, I understand the vision and goal of our CAB. And about 50% of folks were like, yeah, I really agree with that statement. In areas of communication as well, an example of these statements would be that CAB meeting activities are conducted in a language that everyone understands. And I think that really goes back to the idea of, we didn't talk about mental health, even when we started with psychological well-being, and a CAB member raised their hand and is like, I don't even know what that means. What are we talking about here? And now we have the common language of emotional stability. And so most folks strongly agreed with these statements that communication was an area of strength for us. And in the relative areas for improvement, one area was in processes. So an example statement of this was that our CAB has an agreed upon decision-making process. And so there was just a little bit less agreement with that. And I think that's something that we're really working towards now to make that more clear and concrete. And then also in sustainability, which absolutely makes sense. This was really early on. And we were still kind of figuring out what we were doing in the moment, much less for long-term plans. So an example of those statements would be CAB members have support of local institution and formal policy bodies. Obviously, when we were very brand new, that was not something that we had. That is something that we hope that we are working towards to build it on the sustainability of the work we're doing. So in summary, the outcomes that came from this work, these first 4 meetings with our CAB members over the course of a year, was a safe and trusting environment for the CAB members themselves. We developed a shared understanding about the critical aspects of being emotionally healthy and also being physically healthy, and how that builds resilience within the community and within individuals themselves. We also talked about strategies for communicating with others about psychological well-being, and by using the term emotional stability as an example. We really want to destigmatize this, and we really want to make sure that stigma is not a barrier to engaging in interventions or in other services for mental health. We developed the really great diverse list of mental health resources and services. Some are local, some are national, some are global. And we identified gaps in mental health resources and services that we can make sure that we are trying to address as we move forward. And another critical aspect of this, in my opinion, is being able to look back and figure out what is it that's really important? What did we learn from the work that we're doing that we can continue to, carry forward what went well and address what wasn't going so well? And very first thing is that buy-in and openness from the community takes time. It requires trust. It demands respect. It is something that cannot be rushed. It is not something that can be expected or assumed. And making sure that community is not an afterthought, that it's something that those voices are prioritized. Eliciting and incorporating the community voices actually shifted some of our work in the direction that we went. So this really is just further support. I don't think anybody here would disagree with us in saying that it's optimal to work with the community from the beginning, and in our case, convening a community advisory board in the early phases of research development. As I said, this was even foundational kind of prior to there even being a specific research study. I think is going to really serve us well for moving forward. And so this is the foundation on which we are going to build those next more specific activities. And all of this is working towards that guiding principle we shared at the beginning to support the provision and evaluation of resources and services that promote emotional stability in Chicago's Southside community. And so as you will see, Michelle is the ideal person to share with us some of the next steps that we will be engaging in to build on this foundation.
So this is something I'm passionate about when you look at moving forward in this research. Most community advisory boards really operate, in the past have really operated that they want to get feedback from the community on what the researchers are already doing. And like Allison mentioned, it's not really bringing the community in at the beginning in the planning stages of the research project. So when you look at our next phase that we're currently in, this is a 2-year follow-up funding that was received to continue on the project, like Allison was talking about, the sustainability. The community member, I actually was able to join forces with Allison and Diana as a community member in the planning of this next phase. And one thing that was really important was for me to be able to expand the roles of the CAB members, to involve the CAB members more into that. We also wanted to look at broadening the community engagement by sharing the work as we go along the way through focus groups and town halls, and this opportunity here to be able to share publicly what we've done and what we're doing and moving towards. We also thought that we would have working groups. We wanted to be able to build upon the expertise of our advisory board members, because we all come from so many different backgrounds with a wealth of experience, and to be able to give people an opportunity to work on that, to contribute what it is that they know, their experience. If there's an area that they weren't very well versed in, but they might want to learn about, that was also an opportunity for board members to partner together with others who may have more experience to get a chance to learn that skill or that area. So we were wanted to have working groups to plan, execute, and evaluate the proposed implementation of an evidence-based depression intervention. Some of the things that we were looking at engaging the board, the CAB with, were selection of the intervention, how to adapt the strategies, implementation strategies to the group that we were focused on, how to evaluate how effective this intervention would be, and also to be able to deliver the results to the community. Next slide. So phase 2 in action, this is where we're at so far. We've had 3 meetings that we've had in this phase. The first things that we wanted to do was to look at assessing the skills of the CAB members. Not only the skills, but also to see what their interests were. An overview of the research design, looking at how research comes about, what are the steps in designing research, and also selecting an intervention from 3 different approaches that we looked at and identified that would be appropriate for the mental, emotional stability. Now, even though we had in mind that we would have our meetings and then we would have working groups in between the quarterly meetings, we had to be flexible and adapt. And we realized as we went through the process that there was a need to be able to increase focus on research design, research methods, to be able to build that research background for our CAB members. So we kind of shifted our approach to more didactic lecture meetings that would talk about the topic. Say we were talking about intervention, research design, what that is, followed by discussion meetings where we would discuss with the CAB, okay, now that we have the background, let's have a discussion about the potential interventions that we're going to look at moving forward. We wanted to make sure that the CAB was able to make informed decisions, not just to select picking 1, 2, 3. We wanted to make sure that they were deeply involved in the how and the why of it. And we also realized that we needed to increase the contact points with the CAB, because we wanted to, like Allison referred to earlier, we wanted to build the processes in and kind of close that gap around processes.
Thank you so much, Michelle. And so just as a broader overview of where we're going, what we're hoping to do next is that we want to conduct a full-on research study of this community-informed intervention, working on getting the community information gathered now. We want to increase our community engagement by working with other members of the community beyond our CAB members, which Michelle mentioned will involve some focus groups, some town halls, and we're looking into a couple of other options. What we're doing right here is a wonderful example. And again, we are so grateful to be able to be here and doing this. I also mentioned that we're looking into developing a listserv or a newsletter, some other form of connection and dissemination with the community based on the mental health resources list that we shared earlier. Thank you to Olivia, who kindly put that in the chat for you all. And overall, with this, our guiding principle of building up and really being able to sustain all of these emotional stability resources in the community to support folks from all walks of life. And we wanted to share a couple of resources. One, of course, is the mental health resource list itself. We've also been very fortunate to be able to share some of this work at a couple of conferences. The first one that Diana and Michelle put together was for the poster presentation at the C3 conference. Michelle mentioned that she is on the board or part of the planning of the C3 conference, which is wonderful, and they did such a great job of getting that information out there. And I am actually currently at a conference for the Society of Behavioral Medicine, where I am also sharing some of this work. And so we just put our posters up in Google Drive so anybody can access if you're interested in seeing a little bit more of this work, and we will continue to do so as we get more information out there. I'd like to just end with this final thought from one of our own CAB members, that the success of this grant in promoting psychological well-being is providing information that would offer a successful template of how advisory boards can coordinate practices throughout city, county, and state systems. This will improve continuity of message and care. So we hope that this is a template to share that shows how engaging community can lead and promote health of community. Again, mental health is health, and how the community voice is so critical and important at all stages, very early, very often. And with that, we thank you so much for your time and attention. And I would like to invite folks to join the Q&A.
Thanks so much, Allison, Rochelle, and Michelle. If you have any questions, please add them to the Q&A. I'll get us started. So obviously, having CABs are very crucial to this research. Were there things that stood out to you all in creating, in a sense, a community within a community around emotional stability, things that, may have, clashed against some of the existing narratives around African Americans and mental health or emotional stability, or anything else that may have surprised you?
Michelle, if I can invite you, I would love to hear your perspective as a CAB member, starting and joining that group and how you experienced that.
I'd like to say that there weren't too many surprises. I think that there were a lot of commonalities within the group where we all were able to share experiences that we had or friends or family members had experienced. We also were able to look at the term mental health and the stigma that was associated with that, and how that might have been a barrier for people to really seek out help. And some of the feedback from the men on our group, it was good that as the CAB came together, they were comfortable in sharing their insight on what their approach is, how the conversations that they've had amongst each other when they're facing challenges, and some of the hesitancy to be able to seek out or to have conversations around that. So I think that it was a group that we had common experiences, and we were able to build a level of trust that allowed us to feel comfortable talking about it and sharing what we were feeling on that. So I don't know whether or not Rochelle has any other insight.
I would just add that I feel like being a part of this this group, and I like what you said, the community within the community. We could see that we all have the same challenges, which make it easier to be able to share, because we're like, hey, we are comfortable. I must say, when I joined the CAB, that the only person I knew at the time, was like Diana and Michelle, and everybody else was new to me. However, knowing that, we have the same challenges, we have the same passion for our community really help us really focus on the work and being comfortable in that platform, even though that was the first time I know I met some of these individuals. So I really like that sense of, this platform when we can all could share in a no judgment zone and be able to be ourselves.
I completely agree. And I think my greatest surprise was just how willing folks were to be open pretty quickly. And I think that speaks to all of you in being all coming to the table already very open and welcoming and being able to share your own stories and getting that validation and support from everybody else.
Great, thank you. We have a question from Sandra. Is there an adolescent study on mental health?
So there's a lot of research in adolescent mental health. I don't know of any specifically on the south side of Chicago, and I'll see if Rochelle and Michelle will brainstorm any there. We had a discussion about what to include and whether we would focus on mental health of children and adolescents with this group, and especially our folks who are in the education realm, because they're seeing it every day and know that that's really important. Rochelle shared that statistic of the number of high schoolers who are endorsing depression. We know that this is a huge problem. And for our purposes for now, we chose to focus on the adult population in part because that is where schools have a lot of resources that they offer themselves. And so we wanted to fill the gap where we know that adults are less likely to be able to be connected. So we do hope that that's a direction that we can go in the future. And again, I'll ask Rochelle and Michelle to see if they know of something that I'm not familiar with. Yeah, more work needs to be done there, clearly.
Yeah, clearly. And it also seems, mental health, especially in the Black community, it is a controversial topic because it's seemingly taboo, right? And in our work at Public Narrative, we see that a lot in the different stakeholders that we engage with, from youth to adult. Do you see this as something, the study as it is now, intergenerational, that could speak to mental health among the young people in our communities here in Chicago?
Olivia, are you sure you weren't a fly on the wall in some of our recent conversations? Yes, so again, that's something we're trying to figure out how best to incorporate, because we can't address everything at once and with one intervention, right? And also there was so much enthusiasm for this idea of being able to pass on knowledge. So we talked about this specifically in the context of women's health and how women's health and mental health are very much tied together. And there was so much desire to be able to say, hey, we've already had these experiences and we were surprised. We didn't know that what was happening. We would love to be able to pass that on. And so I love your question, because yes, I think there's so much desire for that. I'm less familiar with it from the perspective of adolescents, how open they are to that, and young adults. But I do think that there's so much to be said of having that voice of I want to say authority, but I mean authority in the sense that they have the experience of being able to share that. Rochelle and Michelle, would you like to add on to that?
I would say also, as a parent, I feel like I need to be good myself before I can help my children, because as a parent, acknowledging that I have a problem, I need help, will help me recognize signs in my children that if they need help. So I feel like this process, starting with the adult first, because then, they are the pillar, they are the family, the structure of the family is around the adult, so then if they are well, they'll be able to better address the needs of their children. So I feel like it goes in this direction, I think, for me as a parent.
I just have to say that I was thinking along the lines of what Rochelle was speaking to, that I think that it will have a trickle down effect when we're able to help adults achieve that level of stability. I think that it definitely will help as the, relaying the information to partners, to other friends and family, and to children, and to be able to have an example of that wellness, of that stability. It'll be a good model to follow. But as Allison said, we're hoping that once we're able to do this, that it can be adapted to other groups.
Got you. And part of the areas of improvement that you talked about that came from their feedback in CAB was sustainability. And we know that Chicago has a long history when it comes to providing sustainable resources in this sector of mental health and wellness. How optimistic are you all when it comes to seeing actual substantial resources that will help in implementing the type of feedback and type of solutions and ideas that have been gathered within CAB?
Mm-hmm. So I consider myself to be a pragmatic optimist. And so I think that the approach that I take is try a lot and see what works, and make sure that you are putting your efforts and resources behind the things that are working. We can't address everything, right? We want to make sure we're not trying to fit a square peg into a round hole. And so I am also, after every CAB meeting, I feel so optimistic because of all the enthusiasm that everyone is bringing to those meetings, that I know that there is going to be support for this. What this is has yet to be defined, I think. But I am optimistic that the work we are doing and the way that we're going about it will have a positive impact in the community.
I also think that the fact of involving the community, there's already like the foundation of this work. Mm-hmm. And the goal is like the more people that we involve in that work, will be very intentional to continue this effort to address, the need of more resources, more accessible resources for the community. Because like Michelle went over, there's a lot of resources, but unfortunately it's accessing them, knowing that they are available, being aware of them, and I feel like by this group, like we're hoping that we are able to spread the word to as many people who wants to hear us, but making sure that these resources remain posted wherever we could. And we can start by our families, our network, our churches, and keep spreading the word this way. So like Allison, I remain optimistic, and I hope that, we can continue beyond the CAB this way.
And through this knowledge, this awareness of information, we hope to be able to empower people to be able to kind of direct their own course, because if the information is there, when there's the gaps in, like I talked about, what's needed as far as the education about what's available and the linking the individual to services, once that opens up, I think that it empowers people to be a little bit more able to steer the direction. And I know as just historically, you know, as African Americans, we really have to advocate for our own health and wellness. Even when you're in a medical, you know, setting in a medical center, a doctor's office, we have to be advocates for ourselves. We have to be advocates for our family members, you know, and just opening up the conversation and taking away the secrecy, like you mentioned. These are things that we don't, as families, we don't normally talk about. But if people can feel the comfort that we did in our group, to be able to have the trust there, to know that it's a safe environment, and if we open up those conversations, then not only will we advocate for ourselves, you know, we'll be able to advocate with our sister, our brother, our husband and wife, to be able to go, you know, along with the individual in your family to support them as they seek these resources. So that's what my hope is, and I'm optimistic about it. I think that, you know, once we are empowered, then we are able to navigate. It's not going to be easy necessarily, but we have the tools that we need in order to fight for our own health and wellness, our own emotional stability, to something that we deserve. And, you know, we should be able to fight forward for it. And no matter what the environment, the situation is, that what's going on around us, I think it's a right that we deserve.
Truly. And so it's very much like, you know, there's power and agency, but there's also, and then there's power in number. So having more people feeling they have the agency to advocate for themselves, but also to, I guess, more so recognize that they are going through tough times, and that it's not always self-inflicted. You know, there are environmental factors that make us feel different types of ways. And I think that's also something in the African-American community, the Black community, that we are very harsh critics with ourselves. Everybody's a harsh critic to themselves, but I think as historically oppressed race, you know, there is that inhibiting factor that we are, I think, with the help of groups like and teams like y'all, we help to learn and unlearn those things to have better wellness. In terms of, you know, your next steps, I know you shared some, Sandra, with another question, and maybe a possible good idea. Are there any plans to hold a mental health town hall meeting?
Yes, and thank you so much for giving leading us up, queuing us up for that. We are planning on we have two ideas. They're still in their infancy in terms of figuring out exactly what they will look like and when exactly they will be, but the plan is roughly this fall and then next fall. So being able to share our progress in this work along the way, and also invite some of our other community members to join us in that. So it's not just talking about, oh, these are the data and this is the very specific nuanced piece of what we're doing. But yes, we would love to have that as a really nice community forum.
What does it look like?
And one other thing about that too is that I just want to add one more thing about that is that those meetings are actually going to be conducted by CAB members.
Yeah.
So it's going to be community members talking to community members about these things. So I think that that's something that, you know, is very notable, that that goes to as far as us utilizing the CAB members, and, you know, to be able to have that one-on-one, that's a community member talking to a community member.
I love that idea. And, you know, at Public Narrative, you know, our three pillars of community groups are journalists, media makers, nonprofits, and community. And so having conversations like this is part of our jam, if you will, in really eradicating these harmful narratives that exist around various groups. And of course, we know there's a lot of stigma when it comes to mental health and wellness in the African-American community. I'm wondering, what do you think we can do in terms of our media makers, our journalists in these communities, folks that are city leaders? It takes a village to do this type of work. And it sounds like from your research, from this study, that having investment in time and in people brings out the transparency, the safety, and the vulnerability to get us to breaking up what those root causes are and then figuring out solutions. So how can the rest of us help in steering, I think, this successful engagement to start with into something more and to something that really shows actionable change and growth in our city?
I love that question. I would love for Rochelle or Michelle to start us off. You both have brilliant ideas about this. I should have picked one of you. Yeah. Michelle, how about you start? Michelle spoke last. Rochelle, do you have thoughts you would like to share first?
Okay, I'm sorry. I thought you said Michelle, the shell.
Yep.
I mean, I also think like one thing that we should all need to keep doing is to keep advocating for mental health in our city. It's not only at the resource level, but also at the lawmaker level. Because even like if you think about, Medicaid reimbursement is not always all bad for mental health services. It starts there, because if somebody have to wait 5-6 months to see a provider and then not being able to, and the provider, is selective because he's not getting paid depending on which type of insurance you come in with, So it starts there because I don't think like it should be a luxury to see a provider. It should be a right. And if somebody has an issue, a mental health issue, can you imagine 6 months to wait to see somebody? That person, if it's suicidal, have a chance to bring harm to themselves, to their family. So, the advocacy had to be at every level, at the state level, to advocate for more flexibility in the Medicaid, expansion, around mental health, but also at the local level, to make sure that in our community, we have more BIPOC providers. What incentive do we have to encourage people to go and be licensed therapists in our community? We want to make sure people are comfortable to come to our community and provide the care. So there's so many layers, but I feel like as a community members, continue to make sure that I address my own personal challenges, because oftentimes we don't want to recognize that we are facing those challenges. And it should be at a point when we say it's okay not to be okay. I mean, I know we hear that sentence everywhere, but oftentimes we're still fighting when we're not okay because we're trying to say, oh, I'm tired, I'm stressed, I have too much work. But it's okay to really, do that self-evaluation and know like, hey, I'm not okay, I need to seek help. And at the city level, we need to make sure that when I seek help, I'm able to get the help that I need and not have to wait 20 months or 20 weeks just to be able to see somebody to get the help. Because as we talked about adolescent earlier, if I'm not okay, this negativity is going to trickle down to the family, my productivity, affect every part of my life. So we want to make sure that we continue to advocate for things that should be a right, not a luxury for all of us.
Michelle, do you have anything to add to that?
I kind of echo what Rochelle just mentioned. I think another thing is to be able to have, when you were mentioning about as far as the health services, be it Medicaid or even individuals that have insurance through the marketplace, to be able to navigate, to be able to reach those resources is so important. To have those health navigators that can kind of streamline the process, and maybe to have something available where you're able to have kind of like an intermediary care prior to getting to that professional. I think about many of the doctor's offices. You may not necessarily be able to get to the doctor, but you may have an opportunity to talk with one of the nurses. So, if within those clinics, those nurses are equipped to be able to recognize and screen for some of those mental health issues and challenges, and maybe they may be the navigators that can direct them to other resources that they might be able to take advantage of before actually seeing that health professional.
And before you chime in, Allison, thank you, Rochelle and Michelle. Someone who just joined us, Margarita, asking about the difficulties, if folks are having difficulties in finding mental health providers in the city of Chicago. I did share the mental health resource list that you had, but this adds on to my question about how, other folks in the community, in the city, media makers, journalists, city leaders, nonprofit leaders, how can we show up to build this type of work and investment and show some actionable change here in the city?
Yeah, thank you for that. So first, I would just say that so much of what our CAB members have said is helpful, as Rochelle pointed out, is just being able to share and being able to find validation elsewhere and support from other people who maybe you don't even know and yet have had really similar experiences to you. So I think one thing for policymakers, for journalists, for anybody else higher up is to be able to talk about this. And not only about the problems, but also about these solutions. And that's why I love this initiative that you all brought together. And it's not just about saying like, oh, there's this huge disparity in mental health between Black folks in Chicago and non-Black folks. It's that, well, what are we doing about that? And I think being able to highlight things like this, like there's a lot of really positive things that people are doing. My Block, My Hood, My City, for example, all of the work that they're doing and making sure that that is news too, because it's so easy once something is, quote unquote, fixed or addressed, that then we just put it to the side and move on to the next problem. And being able to highlight what is working, what is going well, I think is so helpful. And being able to open up that discussion among more folks to say, you know what, this is something that I'm struggling with and something that I might benefit from additional help with, additional support that's maybe outside of my usual comfort zone. And so others being able to say like, hey, this is what worked for me. I think there's so much to be said about that personal narrative that can really help to humanize this as a problem, make it more individual and not just at that community level. And then all of that builds on itself, generates more support, garners more interest and motivation for hopefully that groundswell of amazing policy that's going to get coverage for everybody. That's the long-term goal.
So it really, again, I love the words humanizing, also noting that, and I think this is really big in understanding, especially around reporting, that it doesn't just end with one solution. That's not the win. It's a marathon and not, a short race here. And of course, there's this generations of trauma, right, that Black individuals are uniquely figuring it out for themselves. So the monolith does not exist when it comes to emotional stability. I wanted to really ask if you guys could elaborate a little bit more about emotional stability and coming up with that term with CAB. I find it one, refreshing. I am still a journalist, and doing this work at Public Narrative, I've really been enlightened by just how much work we need to do when it comes to authentically engaging and being part of the communities that we write about, my peers, my colleagues write about, and emotional stability, like, it feels like a no-brainer in like breaking down mental health and understanding that the term mental health is there's such a negative connotation, not even in the African-American community, but across the board. You know, when you think about teens and thinking about, you know, mental health, that is a triggering term for them. When you think about the elderly, it's the same trigger. You know, what if I get sent to a nursing home because of that? What if, you know, my children don't think that I can take care of myself because of that? Or what if people don't see me anymore because of, you know, the possible diagnosis of a mental health issue? So how did emotional stability come about? It's such a refreshing term. And what, I guess, you know, in what ways can we also try and support these types of, dare I say, new common language for words that, if we get over that barrier, could really help us push through to focus on those solutions and growth.
I'll go ahead and start, if that's okay, and just explain like the background coming into this, and then I would love for Rochelle and Michelle to build on that. So with my researcher and clinical health psychologist hat on, obviously I'm very well aware of the stigma associated with mental health, which is why I started with the term psychological well-being, thinking that's a little bit of an easier way in. It's a lot more broad and general, thinking, you know, not everybody has mental health, everybody has some level of psychological well-being. And bringing it into that second CAB meeting that Rochelle explained to us, of the question being, okay, so what does psychological well-being look like in your community? The very first question, the first thing one of our CAB members so bravely came up and was like, Allison, what is psychological well-being? What are you talking about? And from there, that really sparked the whole discussion. We abandoned the agenda that we had and really just went and did a deep dive on what that meant to everybody and what was important to everybody in the realm of mental health, psychological well-being, eventually coming to emotional stability. And the one thing that I'll say about the importance of this term to our CAB members was exactly what you're talking about, of finding that balance between currently, how are we feeling? What does our emotional health look like? And understanding that there is this long historical, these systems of oppression that are still in place that are really affecting our ability to have emotional health. And so that's where the balance and finding stability, I think that really strongly played in. So I just want to share that was something that everything you're talking about really played into this. So Michelle, thank you for letting me share that first.
The other thing is that we talked earlier about the stigma that's associated with mental health, the thing that people don't want to talk about within families and within groups. But if you look at emotional stability, it's something to strive towards. You know, for example, if you're in a boat on the water, what keeps you up? You know, what keeps you, no matter what, you know, waves come, no matter what is going on in the water around you, other things that are around you, it gives you internally the ability to be able to stay afloat, have the resilience, to be able to stay strong in the midst of the environmental things that you may not be able to change, and to be able to have that balance, because no one is going to be perfectly perfectly perfect all the time. You know, there are ebbs and flows to things, but with emotional stability is that we thought it was important for people to be able to navigate and to be able to maintain a level of resilience that would keep you afloat no matter what is going on around you, no matter what challenges you may be with. And it's something that people, it's an attainable goal that people can strive towards.
Rochelle, did you have any thoughts to add in? No pressure.
No, I'm echoing what both Alison and Michelle just shared, because it's true. You know, whenever we're doing this community engagement, we want to make sure we're using a language that people can relate to, that people are not gonna fight us with. And I feel like using this emotional stability was easier. I mean, even us as CAB member, we were more inclined to accept it versus going with that big mental health 101, because that will make people like, ooh, I don't want to be part of it. So I do think, like, when doing this work, it is important, and not only, you know, in this study, but every study, to use language that the community can relate to, you know, language that people are not going to provide too much resistance, but more embrace, you know. So I really feel like, and I appreciate the fact that Alison and the team allow us CAB member to come up with those terminology, how we felt about them, because, you know, it's not them telling us, well, we're going to use this for the study. We were all in agreement and in support of using the word emotional stability. So I do think that was very intentional, the part of the leadership to really encourage and support us with this terminology.
It's very therapeutic, I think, to be in this conversation. Just, you know, I think I'm kind of like hitting all the different spots of like, oh, here's a journalist, here's with some mental health, you know, issues, here's, you know, trying to figure out how to better engage with community members. And we're all part of this community, right? And thinking about, you know, human first before anything else, that truly connects us all. So we should be able to have these types of conversations, not just with strangers, but with our families, our friends, our next door neighbors that look like us too. So I really appreciate this conversation that you all have brought to us. I wanted to ask if you had any final words, anything you wanted to share before we wrap up.
I just wanted to add a comment on one of your questions earlier about what from journalists, from your perspective, can do to assist. And I think that if you add some of those resources that are available and maybe spotlight some of those groups and some of those organizations to show what is available, to show the breadth of the services that they offer, or what they're doing in the community, I think that that could help to keep the conversation going and, you know, and build that awareness in the community. You may not want to talk openly about what you're going through, but if you see something with an organization that's providing services or assistance that you may need, I think that that's key, and it might give them an opportunity to feel comfortable enough to reach out.
Rochelle, do you have your final thoughts?
I just want to say thank you for being in a platform like that and talk openly about not only the study, but also about, you know, what it means to be part of a CAB, you know, because oftentimes studies are happening in silos, but I appreciate this platform when we can openly talk about our experience as CAB member and share, our experience, going through the process. So I will encourage people in the audience to really continue to work in partnership with community, to make sure that beyond just emotional stability, other issues that are affecting our city are really being addressed, but not with the community being an afterthought, but the community being part of the conversation since the beginning. So again, I thank you for giving us this platform to really share this experience.
I completely agree with that, Rochelle. Thank you. And yes, so thank you so much to Public Narrative for letting us come in and share this information. We are very interested in being in touch with any of you viewing this now or the recording later. Please don't hesitate to reach out because more enthusiasm, the better. And so this is, I hope, a great example of how to share the amazing things that are being done and helping to highlight and have folks share their personal experiences exactly like we are hoping this will generate. And so we are just honored to be part of this and grateful for the platform. Thank you so much.
And thank you all. Right back at you. And I see Dr. Paris Davis thanking us as well. We really appreciate this conversation. Again, this is the type of work that we do at Public Narrative, really ensuring that there is a bridge between all the different types of people that make this city what it is. And we can't have stories without people. We can't have resolutions without people. We can't do without the people. So it just goes to show that authenticity, vulnerability, transparency, it truly matters, and is really a matter of life and death when it comes to the betterment of your constituents in any part of this country and any part of this world. So really appreciate Allison and Rochelle and Michelle for joining us. This has been Powering the Public Narrative with Public Narrative. I'm your host, Olivia Obinameh, the Director of Journalism and Media Engagement at Public Narrative, and we are so excited to have been part of the Celebration of Healing Initiative in partnership with Congo Square Theater. We will definitely have all of the webinars and the presentations that the panelists have opted to share with the public. We will have that all for you in a follow-up email following the end of this initiative. It is today, but please give us some time to collect all of these notes, wonderful presentations to share them with all of our attendees. Allison, Rochelle, Michelle, thank you again. And to everyone, I hope you have a good rest of your Thursday. Thanks, take care.